cardiac mass. Myxoma is an uncommon cardiac tumor or a tumor that presents in the heart. The left atrial myxome constitutes 75% of all the occurring myxomas, while the right atrial myxoma represents the remaining 25%. Such new growth of tissue is usually a soft, irregular-shaped jelly-like accumulation or the round firm gathering of mass. These tumors are linked with endocardium, the inner lining of the cardiac. Myxoma tumors do not arise due to any causative agents. Myxoma tumors are the result of multipotential mesenchymal cells and may lead to a ball valve type barrier. Almost 10% of such patients acquire such tumors due to hereditary reasons. Welcome to BCT News, where we bring you the latest case studies from the world of cardiovascular health. In today's report, we will be discussing a rare and intriguing case involving left atrial myxoma, a condition that possesses potential risk if not detected early. To give us an in-depth look at this case, we have CVT Heidi Natasha, who will walk us through the details. Before we proceed from Heidi's presentation, I would like to give an introduction for the case study that we have here today. Our case today involves a 50-year-old female who presented with high blood pressure for the past 2-3 years. Despite her ongoing antihypertensive therapy, she remained asymptomatic with no significant physical findings. However, an echocardiogram revealed something unexpected. Due to the asymptomatic situation, suddenly the echo revealed something unexpected, which is a mass in the left atrium, which raised suspicion for a cardiac myxoma. This woman had no symptoms, so we will leave the rest for CVT Heidi to present the case. CVT Heidi, can you tell us more about atrial myxomas and how they typically present? Okay, Assalamualaikum everyone. I am CVT Heidi. First of all, I would like to say thank you for inviting me to your BCT News. It's very good for you to have this case study discussion among all of you, so you get to know what is out there and what to expect. Okay, first of all, let's talk about atrial myxomas. Okay, so atrial myxomas are the most common type of primary cardiac tumors, and they typically arise in the left atrium. That's why it's called atrium. As we saw in this case, these tumors can be asymptomatic, especially when they're smaller than 5 cm. In fact, many patients are unaware of the mass until it's discovered incidentally. Like in this case, this patient had no kind of symptoms that could indicate maybe at least palpitation, at least shortness of breath, that could at least dyspnea, that could actually indicate that a person have a intracardiac mass. But this patient was asymptomatic and then accidentally discovered a mass in echo. So, though it is asymptomatic, myxomas can lead to serious complications such as embolic events or obstruction of the heart valves if left untreated. Okay, that is interesting. So, how was this patient's condition confirmed? Okay, we start with the patient condition when arriving at the hospital. She was asymptomatic with stable vital signs and normal physical examination findings during her hospitalization. Transesophageal echocardiography or normal chest x-ray were then performed even though all of the vital signs were normal. And then coronary angiography was performed with no significant coronary artery lesions, and even if you look at this ECG, also it shows a normal sinus rhythm with non-specific changes. So with echocardiography, transthoracic echocardio, after detecting the mass with the transthoracic echocardiogram, we confirm that the mass was located in the left atrium. It measured 2.97 by 4.28 cm, but fortunately there was no obstruction of the mitral valve orifice, so this is kind of like an early detection. It's very fortunate. It's like, thank God we did the echocardio. So to ensure we had a clearer picture of the mass itself, is that we conducted a transoesophageal echocardiogram, which allowed us to get better image of the mass, confirming that it was attached to the interatrial septum and not prolapsing through the mitral valve. Can you imagine? Okay, you see here in this 3-chamber view of TTE here, you get to see this mass right over there. So it's confirmed that it was attached. I will show you the movie image later. Okay, it was confirmed that it was attached to the interatrial septum and not prolapsing through your mitral valve. You know, this could actually, if this was a bigger or a bit further, then it could actually obstruct the mitral valve orifice. This is the TEE. Here is the AOPA level. The parasternal short exists. See, it's quite big at the left atrium, as you see, right? So seeing this also, it was fortunate really. And then the second, this is the parasternal long exit by TEE at the right atrium. You see how it's attached to the interatrial septum. And then see, yes. Now I see. Okay, CVT Heidi. Once the diagnosis was confirmed, what steps were taken for the treatment for this patient? Okay, the steps taken for the treatment is that the patient was transferred to a surgical center where the myxoma was successfully removed. Surgery is the treatment of choice for cardiac myxomas, and the operation went very smoothly. The histopathological examination of the surgery confirmed that the tumor was indeed a myxoma. Okay, and how is the patient doing now after the surgery? So even a regular follow-up also, there is no signs of tumor recurrence, and 1 year later she remains asymptomatic and continue her antihypertensive therapy with a positive prognosis. That's great to hear. This case really shows the importance of early detection and timely intervention. Exactly, students. Even asymptomatic patients can benefit from routine screenings, especially when there's an incidental finding, like this case. Early detection of cardiac myxomas through echocardiography allows for successful treatment and also a good prognosis. Our patient is a prime example of how timely surgical removal can lead to a full recovery. Alright, thank you all. Thank you. I hope you guys do the best and read more case studies so you can get familiar with what is happening in the real world out there. Okay? Thank you so much. That is all for today's case study on BCT News. Thank you so much, Heidi, for sharing your expertise with us. And thank you to our viewers, BCT students, for tuning in. Stay healthy and stay informed.